take the time to thank all of you guys for joining me here today. I've recently done a lot of research on a topic that I feel like will be beneficial to all of you. I want to start by asking you guys, how many of you guys have ever smoked a cigarette in your life? Okay, and how many of you guys know a smoker? Okay, so all of you. And how many of you guys are current smokers? All right, did you guys know that smoking causes more than 460,000 deaths each year in the United States? I've recently gathered a lot of information using the Center of Disease Control website and the Better Health website, both which are reliable resources for research. As we all know, smoking can have many negative effects on a person's life. Cigarettes contain many harmful chemicals that lead to negative health effects and can lead to the negative effects of secondhand smoke. I want to start by talking to you guys today about what all is within a cigarette. Can any of you guys guess how many chemicals are in a cigarette?
Over 100.
3,000.
According to Center of Disease Control, there are up to 7,000 different chemicals in a cigarette. I'm going to talk to you guys about a few of these chemicals today. I'm going to pass this sheet around and it shows some of the chemicals that are in a cigarette. Cigarettes contain carbon monoxide. Carbon monoxide replaces oxygen in the blood and makes less oxygen reach the heart, the brain, the lungs, and other vital organs, and this can many times be fatal. Cigarettes contain tar, which is a sticky brown substance that collects in the lungs and can stain the lungs, the teeth, and the nails. It is also a carcinogen, which means it's cancer-causing. Cigarettes contain free radicals, which damage the airways to the lungs and make it hard for a smoker to breathe on a daily basis. And many of you guys wouldn't think, but cigarettes even contain radioactive compounds and metals such as arsenic, cyanide, lead, and cadmium. Now that I've talked to you guys about some of the chemicals in cigarettes, I'd now like to talk to you about what these chemicals can do to the human body. Cigarettes can cause cancer. According to CDC, 90% of all lung cancer deaths in the United States are due to smoking cigarettes. I'm going to pass this picture around you guys. It shows the comparison between a smoker's lungs and a non-smoker's lungs. Smoking can cause cancer in almost every area of the body, including the bladder, blood, cervix, colon, esophagus, kidneys, larynx, liver, throat, tongue, tonsils, pancreas, stomach, trachea, bronchus, and lungs. According to Better Health, 1 out of every 30 cancer-causing deaths in the United States would not even occur if people didn't smoke cigarettes. Smoking can even cause many types of diseases such as coronary heart disease, cardiovascular disease, and it can cause people to have strokes. Smoking damages the blood vessels and can cause blood clots to form. These blood clots can then lead to heart attacks. Smoking causes many other negative health effects such as asthma, cataracts, which is the clouding of the eyelids, rheumatoid arthritis, and type 2 diabetes. People who develop diabetes due to smoking have to change their lifestyle dramatically in order to deal with it throughout their lives. Smoking can affect pregnancy. It can make it harder for a woman to become pregnant. It can cause negative effects before, during, and after the pregnancy. It can cause a baby to be born early. It can cause stillbirth. It can cause a baby to get SIDS. It can cause a low birth weight where the baby doesn't weigh nearly as much as it should at birth. And it can even cause the baby to have a low immune system, making it harder for a baby to fight off illnesses. Smoking can cause an infection known as gangrene, and people who develop gangrene often have to get limbs amputated. I'm going to pass around a picture of a patient who developed gangrene due to smoking and had to get it treated. Okay, now that I've talked to you guys about the effects that smoking can have on a smoker, I'm also going to talk to you about the effects that smoking can have on those around them. This is known as secondhand smoke. Secondhand smoke occurs when a smoker exhales. Those who are around them inhale those harmful chemicals. According to CDC, since 1964, 2.5 million deaths in the United States have occurred due to secondhand smoke exposure. Secondhand smoke has just as many cancer-causing elements and disease-causing elements. People who are around secondhand smoke can develop asthma, they can develop cancer or cardiovascular disease. Secondhand smoke has caused 15,000 hospitalizations in children 18 months and younger in the United States each year. So it can affect children in many ways. It can cause children to develop respiratory infections, ear infections, and can cause them to have asthma attacks. Many people think that ventilating buildings will get rid of secondhand smoke exposure. People will try to open windows or blow fans in order to get rid of the smoke, but this does not get rid of the secondhand smoke exposure because it still happens when people, at the time that the person's smoking and the people around them still breathe in those harmful chemicals. I feel like the information I've given you guys today should be taken seriously because it can affect a person's life in many ways. As I said, cigarettes contain many harmful chemicals. They can lead to many negative health effects and the many negative effects of secondhand smoke. Smoking is the #1 leading preventable cause of death in the United States. This means that you don't have to face these negative effects. You have the choice to either never pick up the habit and to stop the habit. Many people think that they've been smoking for way too long, that it's too late to try and stop, or that stopping wouldn't do anything for them. But if you do choose to stop, your health can increase by at least 2 times, so it's never too late. Your life depends on your health, so why ruin your health when you have the choice not to? I hope the information I've given you has been beneficial to you, and I hope that it sticks with you when you leave here today. And I hope that those of you that are current smokers, when you leave here and you get in your car, I hope you think twice before you light one up.
Me too, Jesse.